When it comes to treating scoliosis, the location of the curve matters. For example, the curves in the thoracic spine during growing years or during growth spurts tend to progress at a faster rate as compared to curves in the lower spine. However, after skeletal maturity, when you're done growing, curves in the lower spine tend to progress at a faster rate as compared to curves in the upper or the thoracic spine. Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and the head scoliosis clinician at ScoliCare Denver. Now, the other thing we have to look at is curves in the lumbar spine or in the lower spine have a smaller window of opportunity to effectively treat before they're recommended for surgery as compared to the thoracic spine. That's because curves in the lower spine are typically recommended for surgery when the curves hit a minimal threshold of about 40 degrees. Compared to the thoracic spine, curves in the thoracic spine are not typically recommended for surgery until they hit the minimal threshold of about 50 degrees. So when we're looking at curve size, we have to also consider location because curves in different spots are going to hit that surgical threshold at different times. And as I just mentioned, when it curves in the lower spine, we have a smaller window of opportunity to get the treatment right. Additionally, curves tend to progress differently after skeletal maturity, so that can impact our goals. So when we look at treating scoliosis, the number one goal is to prevent things from progressing to surgery. But most orthopedic centers really only consider preventing surgery during adolescence. We have to look beyond adolescence. How could the curve and the location of the curve and the size of the curve potentially affect that patient, not just during adolescence, but throughout their entire life? Now, to help really hit this point home, I want to show you a patient that came to our office. And this patient was originally diagnosed with scoliosis when she was just 12 years old, which is when a lot of girls develop scoliosis between that 10 and 12 year range when they first start going through growth spurts during puberty. Had she had the effective treatment and highly effective treatment, her life probably would have been different and what she had to do as an adult would have been different. Now, this patient didn't come to see us until she was 52 years old and she could tell her curve was progressing. So let's take a look at her case. So this first x-ray is an x-ray she had brought in. This was taken when she was 45 years old and back in 2018. She didn't get to our office until 7 years later. But in this right here, you can see she has a lumbar scoliosis. She has a right lumbar scoliosis, and which, by the way, can be a risk sign for underlying pathology, and it was 35 degrees. When she came to see us 7 years later, her curve had progressed to 51 degrees. Now, as I mentioned, curves in the lower spine have a higher risk of progression. A curve that you had when you were an adolescent that you still have in adulthood tends to progress at about 1 degree per year. It tends to speed up though around the onset of menopause. So she was 52 years old when she came to see us. She said that she had started menopause at about 50. So it's possible this had progressed more rapidly later on, but it was progressing 2.5 degrees per year. And we know that's only going to get faster and faster over time. So as mentioned in other videos, curves beyond 30 degrees have an increased likelihood of progressing after skeletal maturity. Once they're over 50, they will 100% progress. But it's not just the size of the curve, it's the location. You see, a lot of people think that smaller curves are not likely to progress when someone's done growing. But we know curves in the lumbar or thoracolumbar spine can still progress and actually have a higher risk of progression than curves in the thoracic spine after skeletal maturity. The reason for this is you have this bony structure. You have your rib cage and you have your clavicles and your collarbone, and that kind of works to help stabilize the curve to some degree once someone is done growing. But we don't have that in the lower spine. And so when someone's done growing, the reason for progression is different. So curves in the lower spine, even if smaller, can still progress when someone is done growing, which is why we need to try to get those curves as small as possible during adolescence when we have the most effective window of opportunity to treat these and reduce the size of the curve. The other thing we have to consider is potential red flags. So 80% of all scoliosis is idiopathic scoliosis, but there is another 20% that's caused by some underlying pathologies. So normally when we look at curves in the thoracic spine, it's more normal to have a curve on the right side. So if we see a curve in the left side of the thoracic spine, that's a red flag. And that means that there's a higher likelihood that there could be some underlying pathology that's actually driving or the underlying cause of the scoliosis. Also, curves in the lumbar spine on the right side is a red flag, meaning that could be some underlying pathology that's actually driving the scoliosis. The reason that's important when we see those things, that should get our attention to really dig deep and make sure we absolutely rule out all underlying pathologies or other potential causes, and also that we may need to do some additional diagnostic tests like an MRI to rule out other potential causes of scoliosis. And the last reason that location matters is because what makes one curve better on one side can make the other curve worse. For example, if you have a curve on the right side in your thoracic spine and a curve on your left side in the lumbar spine, their curves are doing the opposite thing. So what makes the thoracic spine better is going to make the lumbar spine worse. We have to consider this when we're designing a brace or when we're doing scoliosis specific rehab. Also, many times when there's more than one curve, there's one curve that's the primary curve, meaning that's the curve that's actually driving the scoliosis. The other curves could be a secondary or tertiary compensatory curve. You have to know what's driving or causing the scoliosis when we're designing our treatment. In other curves, you may have two curves that are equal importance. We call those a double major curve. And although those curves are generally more stable if they're balanced, they're also more difficult or more challenging to treat. The location of the curve also is a predictor of how likely it is to reduce the size of those curves. Additionally, treating one curve compared to two curves is something we have to consider, because treating one curve, we have a higher likelihood of reducing the size of the curve as when we have two really large curves. The other thing is some places, some treatment centers believe curves in the upper thoracic spine cannot even be corrected, so they don't even attempt to treat them. And because where the curve is in the spine is what really dictates how we design braces and also how we go about doing scoliosis specific rehab. That's why there's no one size fits all. It's also why when you take a brace that's prefabricated and you try to make adjustments to it afterwards to treat a patient with scoliosis, those braces are not generally that effective. That's why at ScoliCare, all of our braces are 100% custom designed from scratch for each individual patient. And it's also why our rehab methods are customized for each patient. I get asked all the time, what's the best exercise for scoliosis? Well, that really depends on your scoliosis. There is no one best exercise or fits all for each and every case. So one of the things we absolutely have to consider is location of the curve when we're looking at the risk of the curve progression, what the treatment goals are, and what the most effective treatments are going to be, and how we're going to properly apply those effective treatments. So if you're watching this and you have scoliosis and you're not even really sure where the curve is or how the location of your curve could impact your treatments, so click on the link below and request a free discovery call where we can review your case, let you know what your risk of progression is, and what treatment options are available to you. And to learn more about the most effective non-surgical treatment options, check out the next video.